All right, it's time to plan out your health care coverage in this time of year. Many people are reevaluating their health insurance and coverage plans for 2026. And tomorrow begins what's called annual enrollment period. From October 15th to December 7th, people on Medicare can make changes to their health and drug plans for the next year. And a reminder, people who qualify for Medicare, that's anyone 65 and older, has a disability, is in end-stage renal disease, or has ALS. So joining us now, we have Ari Parker. He's a co-founder of Chapter, which is an organization that helps people find the best Medicare coverage plan for their needs. Thank you so much for your time, Ari.
Thank you so much for having me.
So help us do some homework today, really to plan for tomorrow. What kinds of documents do we need to just get started, get prepared?
The Medicare open enrollment period begins tomorrow and it ends December 7th. For those who are already on Medicare, this is your opportunity to adjust your coverage for 2026 and make sure that you're on the right plan for the upcoming year.
So
you should have received...
Go ahead. No, we should have received what again?
You should have received your annual notice of change if you're already on Medicare. This will describe how your plan will operate in 2026. Review that document and write out your 3 Ps, your providers, your prescriptions, and your priorities, and then make sure that you review your coverage over the next 7 weeks.
So Ari, what kinds of questions do I need to be asking myself before picking a plan? What are the questions?
What you want to ask yourself is, what doctors do I want to see for the upcoming year? What prescriptions do I take? Have your medications changed? And are your priorities different than the previous year? And even if you were on the right plan for last year, you want to make sure to review your coverage over the next 7 weeks, because the plans change year over year and the regulations change too.
You're right. Things do change, and you can't just assume that the following year it's going to be the same as the year prior. You really have to make sure about that. So what is the difference between original Medicare, Medicare Supplement, and Medicare Advantage plans? I know they're all different in their own ways.
Yes. Original Medicare refers to Medicare Part A, which is your inpatient hospital coverage, and Medicare Part B, which is your outpatient coverage. What many are surprised to learn is that original Medicare only covers 80% of your medical expenses. So you need coverage for the other 20% that you owe out of pocket. Here you have 2 options, and they're mutually exclusive. Option 1 is to choose a Medicare Supplement plan, which is also known as Medigap, and sits on top of original Medicare. If you go this route, you also want to choose a standalone prescription drug plan to make sure that you have your drugs covered. The second option is Medicare Advantage, which is what you commonly see advertised on television. This is a replacement for original Medicare administered by a private insurance company and subject to those private insurance companies' terms and conditions. So it's managed care.
And so I have a question. Whenever you decide, okay, I'm going to go this route, right? And then you might make, well, something might change, or maybe I should have done this instead. Can I make changes to my plan after that December 7th kind of window closed?
It depends on what type of coverage you're on. If you're on Medicare Advantage, then you may have an opportunity to make another change at the beginning of the year. But if you're not on Medicare Advantage, then your opportunity to adjust your coverage begins tomorrow and it ends December 7th.
And right now, government shutdown, what kind of impact could this play on Medicare coverage and just plans in general?
The government shutdown isn't affecting people's ability to enroll in Medicare. You can still enroll in Medicare if you haven't started yet, and it's fast, safe, and secure to do through your online Social Security account. Now, the government shutdown may have other effects. It might lead to slower processing times, for example, but that's something that our team is here to support you with if you experience any delays due to the shutdown.
Ari, before we go, is there something I didn't ask you that you're thinking, well, this is something that people need to know about, something I failed to ask maybe?
On the prescription side, there's a big regulatory change that's going into effect. There's going to be a maximum out-of-pocket on your prescriptions. It's going to be $2,100 for the upcoming year, which is great news for seniors. There's a cap of $2,100 on your prescriptions. But in order to take advantage of that change, review your coverage starting tomorrow and Do it before December 7th. So that way you choose a plan that covers each of your prescriptions. Because if you don't choose a plan that covers your prescriptions, then those prescriptions aren't subject to that maximum out of pocket.
That's a really, really good point because prescriptions, they can be so incredibly pricey. Thank you so much, Ari. We appreciate your time and your input.
Thank you so much for having me.
Thank you.